So I first went to Indonesia, as Julia said, 18 years ago to study orangutans. And it has been a very profound experience for me to see the environmental destruction that has happened. Borneo has had the fastest rate of deforestation in the world. I lived deep in the forest. It was so exquisitely beautiful. The forest stretched to the horizon. And it is no longer like that. And it is not just me that has seen that. It is all the local communities there. And they know it. They live on the frontier of ecological collapse. All right, so I'm going to tell you tonight about this program, Saving Rainforests with a Stethoscope. That's kind of strange, right? And this is, in fact, the first time in the world this kind of program has been done. But I want to tell you about why it is that we did that and what's important about trying to save both lives and rainforest and how they are interconnected. So human and environmental health are intertwined. I know many of you know this, right? Like your professor said, this is like obvious, right? But it's very much not the way that biologists think about it. It's not the way that doctors think about it. But I'm going to give you a few examples that really illustrate this case. Deforestation is now clearly shown to be linked to increased malaria. There is a study last year that came out that just a 4% decrease in forest cover led to a 50% increase in malaria. Another study showed 278 times higher biting rates of Anopheles mosquito in logged forest versus unlogged forest. And then, of course, we all know this even from here. Forest is a watershed. It's incredibly important for holding water, for preventing floods, and for preventing drought, really. And the people there know that. They know it intimately. The man who owns that rice field right there, I was sitting there one day talking to him, and he tells me about how he used to be an illegal logger. And now he works in this rice field, and he says, I now totally get it. If we cut down the rest of the forest, there will be no water, and we will not be able to grow our food, and we are all going to be malnourished, and many of us will die. This is for them a very, very direct link. And he has been working with us to get all of his neighbors to stop. But there's a problem. And he says that some of his neighbors talk about this. Okay, fine, we'd love to stop. Actually, all of the loggers want to stop. But the problem is, what do you do if you have a medical emergency? Then, almost the only way in our area to get liquidity, to get the money to pay for healthcare, is to do illegal logging. The pivot of our model is excellent healthcare and non-cash payment options. People can pay with manure, they can pay with seedlings, they can pay with labor that we use to reforest land. We had a little girl come in to our clinic who had scabies. Does anyone here know what scabies is? Yeah, it's like this little mite that can get in your skin. It makes it really itchy. You know, I mean, it's very easy to treat. It is no big deal. Well, this little girl, their family had spent $500. They had seen multiple doctors, multiple nurses, multiple traditional healers, and no one diagnosed her. They spent $500 trying to make her better. They came to our clinic, and for $1.50, she was cured. Right? So this is what it means to not have good health care. Okay, so that leads to environmental degradation, which then leads to worse healthcare. So healthcare, this is, like I said, the pivot of our model. In July of 2007, we opened the ASRI Clinic. And like I said, we've had 25,000 patient visits. We have 72 staff members now. We've trained over 40 Indonesian doctors. We also have a mobile clinic, ambulance service. We have a DOTS program. This is a way to prevent drug-resistant tuberculosis. We give out eyeglasses, we've done cataract surgeries 2 years running, given out 4,000 mosquito nets, and we do free birth control as well. So okay, so that's sort of the healthcare side of it, but how do we integrate the environment into our work? And in everything we do, we integrate the environment. We give out mosquito nets to prevent malaria, but people have to pay for those mosquito nets with seedlings, which we use to reforest to also decrease the rates of malaria. So patients, like I said, can pay with goods and services. And this is important as well. Why not just give free healthcare? Well, my own experience in Aceh after the tsunami was that when you gave things to people for free, I actually saw patients take free medicine, walk outside of the clinic, and throw it away. Expensive medicine. And I would say to them, why are you throwing that away? Well, it's free. It must not be any good. And actually, that is the way we all think about it, right? And there's another issue. It's about sustainability. It's about how can this program continue for the long run. But the critical issue is that you have to be able to afford it. You want healthcare that is valued, that you have dignity, that you have respect, that you know that everyone is treated equally, that you know what you are getting is valuable and good. And at the same time, you have to be able to pay if you don't have any money. So the way that we do that is people can pay with non-cash options. It's the same price, but they can pay with non-cash. And then non-logging villages get extra discounts. Okay? We came to communities and we said to them, if the world was willing to say thank you to you for being guardians of a precious resource that is valuable to the whole planet, what would you want? And they loved that. That is fair, that's right. Yes, we should be being, the world should say thank you to us. But it's also true they should only say thank you to us if we are protecting it. If we're cutting it down, fair enough. We don't get the thank you, right? So villages that are green, i.e. they are not doing any illegal logging during a given month, during that month, they receive extra discounts. Everyone gets discounts, everyone gets seen in our clinic. But logging villages get extra thank yous. So the communities say, we've never seen a program like this. We have never experienced anything like this. We feel like it belongs to us. So ASRI is the name of our clinic in Indonesia, and it means harmoniously balanced. And they talk about how we designed it, and they did design it. Our experience over and over and over again is, you want to know how to save the planet? Ask the communities. They know. They know what the solutions are. They don't always have the resources to make those solutions happen, but they know what should happen. So when we first went, like I said, we asked them, what would you want? And they told us things that were surprising to us. And they have borne out to be excellent choices. The first one was reliable four-wheel drive ambulance service. Because when you are hemorrhaging after birth, you cannot get on a motorcycle, you cannot get on a bicycle. And they needed four-wheel drive, because I'll tell you, some of these villages are really hard to get to, right? And the government clinic actually has an ambulance, but it usually doesn't have gas, it often doesn't have a driver, then it's not four-wheel drive. Then they wanted mobile clinic visits. Okay, I might have been able to predict that one, and we do those twice a week now. Organic farm training. What? That's what you want? Yes, that's what we want. Organic farm training. Why? Because the traditional form of agriculture there is slash and burn. Cut down forest, plant one crop of rice, let it grow up. About 7 years later, you can cut it again. But then you can usually only do that 2, maybe 3 times. Okay, that worked relatively well when there was lots of forest and not very many people. It doesn't work anymore, and they know it. And many people have moved to wet rice agriculture, like I showed you that picture in the beginning. But now, they're buying very expensive chemical fertilizers, spending as much as $20 every 3 months. If you're making $13 a month, that's outrageous, right? So, and they didn't know that you could use manure. They did not know. So there was no price for manure in the villages when we first started. Now we've trained people, and now there's not only a price, but there's not enough manure. So we had to start a new program called Goats for Widows, which, as one of my friends says, is self-explanatory. So that provides a lot of the manure in the villages where we work. Some of our farmers have seen a doubling of yields with organic methods and 10 times lower cost. Dramatic improvements. Why did we do it? We did it because they asked us for it. The next thing they've been asking us for, they've been asking this for about a year before we managed to get the funding to do it, was they said, we really need forest guardians. We need someone in every single little hamlet all the way around the national park to work with you to find solutions specific to that village. Because they wanted to stop logging, but not every village was able to. So how are we going to find specific solutions in each village? In one of the villages, one of our forest guardians, there were 3 illegal logging teams. He already got 2 of them to stop. And he says, I'm convinced I can get that 3rd one to stop. So we're thrilled. It's going really, really well. Rainforest is 5% of the planet and contains 50% of the species. This is something that we all have to work to save. For me, this is about saving the planet for all of us. Working, I believe we are blessed to share this planet with amazing biodiversity. And I want you all, when you think about your lives, and you think about what you can do, think about how you too can step off that cliff. Make those hard decisions. Think about how we, as humans, can radically evolve. How we can come to a space where we really understand our planet as finite and understand it as a place that can be sustainable and healthy for all of us for the long run. And how can we find solutions to make that happen? Thank you.